Back to our top story now, the tragic suicide of a Nova Scotia teenager. Rehtaeh Parsons' mother has been speaking out, describing her daughter's struggle with bullying and depression.
She never kept her feelings to herself, that's for sure. She always spoke out of her feelings, emotions, her anger, her sadness. I felt it with her every day. She put herself in the hospital last year because she didn't want to kill herself. So, she kept trying, but they just wouldn't leave her alone.
So one of the issues raised here is the cause and effect between bullying, including cyberbullying, and teen suicide. To talk more about that, we have brought in a psychiatrist, Dr. Shimi Kang. Thank you very much for joining us. You've dealt with a lot of adolescents over the years dealing with suicide issues. Is the cause and effect that straightforward?
It's complex. Bullying is definitely a factor, cyberbullying, but we know there's lots of risk factors: depression, anxiety, drug and alcohol problems, trauma, sexual assault, child abuse. All of these factors are really significant, and of which I would say mental health is the biggest.
So in your practice, have you seen bullying as one of those factors?
Yes, absolutely. I mean, it's, the young brain is exquisitely sensitive to social pressures. It's supposed to be that way, but the bullying makes it even more dramatic.
So parents here, the criminal justice system generally, would like to take on the bullying part of that. But in a way, we've seen it for generations. Bullying, it probably will continue to happen. If we assume it will continue to happen, what are some of the other things we can do to try to reduce the number of teen suicides?
Sure. I mean, that you're talking about regulation, and I think that's important, but also intervention and early intervention. If we know a young person is being bullied online, getting that person support and help, educating the family. Many health professionals ourselves are trying to just learn all about this new technology. And then on the prevention side, really talking to young people about empathy, standing up for your friends and standing up for things that you don't feel are right. So there's the whole spectrum: prevention, intervention, and regulation.
It can be tough for parents to try to break through a teenager's state of mind, even at the best of times. What should they be doing to make sure, or try to make sure, that their kids aren't vulnerable to suicide?
Right. The most important thing for a parent, and actually anyone interacting with young people, is that bond, that human connection with them, getting to know them and valuing who they are. And what I find in my practice is amazing is they will tell you if they trust you, and if you're genuine in your interest in them. So staying connected, asking the right questions, trusting your instinct, because parents know their kids, and teachers, and really following through if you think someone's at risk, getting help, creating a support, a community around your child, and going to the right professionals.
So those are some general things. Any specific things that parents or caregivers or family members should be looking for?
If there's a change in behavior, that's a big risk factor. A child who used to like playing soccer suddenly doesn't, or change in grades, or a drop in functioning, and that gets back to knowing your child. Drug and alcohol problems, dropping grades, any disconnection with life, those are all risk factors. And again, adolescence is a tough time, and I think just to recognize that there are mood swings, there's hormonal changes, there's developmental issues. They have to step out in the world and learn how to be adults, and supporting them and having empathy for their challenges. And 1 in 4 young people do think of suicide, but really to take that seriously, but also recognize that this is a tough time for young people.
Dr. Kang, thank you very much.
Thank you.